Now, when a person is interested in exploring permanent makeup or cosmetic tattooing, they would make an appointment for you and then come to see you for a consultation. Is there usually treatment on the same day, or
we usually plan in the time, because I would say 90% of the people, once they meet me, once they're comfortable with what I have to say to them, and they have all their questions answered, they usually go forward with the procedure at the same time.
Be so kind, Julia. I think that would kind of maybe demystify the process for our viewers and people interested in that. How is it done? How do you do it?
Basically, it is tattooing. It is a form of tattooing, I would say. But there's a distinct difference between your traditional tattoo, which is done mostly on the body in form of a design, than what I do. Also, there's also a distinct difference within my industry. Most technicians will use a machine to perform, eyebrow, eyelashes, or lip enhancement. However, I use a hand tool. So that becomes what we call semi-permanent makeup, because I do not tattoo or I do not go as deep into the skin as a regular tattoo would. Therefore, I only tattoo the color into the layers of the skin where the skin rejuvenates itself. So after about a year or two, it starts to fade. So we recommend our clients to come back every year for what we call a boost, and that keeps the color nice and fresh. So if you decided to never have this again, and said, oh, this was nice, but I don't want it anymore, within 3 to 5 years, it will completely dissipate to nothing. So that's the semi-permanent tattoo, as we call it.
Now, tell me about this hand tool that you're talking about, and how does it contrast with a normal machine?
Yeah. Well, there are a lot of fancy machines out there now, and they have the digital machines, so to speak. But with machines, there are a lot of technicians that do beautiful work with the machines. But I found I did learn on a machine myself 15 years ago, but then a few years later I was introduced to the hand tool, and I really never looked back, because the unique thing about the hand tool is that it makes everything look very natural. For example, on the eyebrows, I can do what we call a brush stroke technique. It really mimics real hair, and it gives it this 3D effect. Even with people with absolutely no eyebrow, I can recreate an eyebrow and make it look really, really real and realistic. So there's no question if that's a tattoo or not. People will just not know. Unless you tell them that you had a tattoo, they will not know that you had anything done. And that's the purpose. They want to go on with their normal lives. They don't want to run around having people say, oh, what do you have on your face, so to speak. And traditional tattoos will always make it look a little bit more mechanical, just due to the fact that it's a machine. And it's not an artist. I can use it almost like an artist tool.
Now, obviously, everybody understands that tattooing means that you put pigments, tiny little pigments, into the skin. And you made a reference to the fact that the deeper the pigment is placed, the more permanent the pigment will be. If you put it in the more superficial, what is called the dermis, or in the superficial, more epidermal layer, these are parts of the skin that actually enjoy a faster turnover, and eventually it will go away. Therefore, semi-permanent, something that lasts a year or two before maybe a touch-up maybe necessary. But how do you, with your hand tool, is that also a tool where basically a tiny needle goes back and forth?
Yes. Actually, there's a cluster of needles. It's not just one needle, it's a cluster of needles. And it depends on what you're doing. For example, if you're working in a bigger area, you'll have a bigger cluster of needles, of course, and a smaller area where you have to be more refined, then obviously you have a smaller cluster of needles. So they're either aligned or they're in a cluster as a round. Together. So basically that's how it's
first thing that people are going to say when they hear needle is like, ouch.
Yes, exactly.
And me dealing with needles every day, I can tell there's certainly
that
a
panic,
lot of fear out there of needles, and people don't realize that actually what makes a needle truly painful is when it's small or when it's big. That will be quite painful. If it's small, it gets less painful. What is kind of the
It's about
the pain,
yeah.
the pain that your clients would be.
The pain level, I can say that eyebrows, if you had your eyebrows done, it's about the level of tweezing. Tweezing your eyebrows. So.
Doesn't mean much to me, but I'm
Well,
sure most women know what that means.
Exactly,
Yeah?
exactly. It is not painful in the sense that it's excruciating. It's just it's a little annoying. You want to get it over with quickly, but it's not something that you can't endure, and it's very fast, basically. I plan on an hour with you, but basically with the consultation and the discussing of the shape and the color and all that, it really boils down to 20 minutes of treatment. And so I do pre-numb the area with lidocaine, 4%, just your regular over-the-counter topical anesthetic.
Just put it on the
you
skin.
put it on the skin, and it just takes the edge off a little bit. And then that's about it. I mean, it's really not a big deal. Eyes is even less than eyebrows. You would think eyes would be more sensitive, but I guess because of the thin skin on the eyes, the numbing takes very, very well. So people feel no pain on the eyes. And lips is a little bit more involved. Right. And I can't lie about that. Lips have a lot of nerves, and but we do pre-numb them for a half an hour to an hour before the treatment. So
also with a topical
with a topical, and usually people can muster through it. You know, but eyebrows and eyes is not a big deal at all. The only people that really will experience a lot of pain are the people that do not numb when they go to the dentist in general. You know, they will have to have that second Novocaine, you know, because their body just absorbs it or whatnot, or
works
resistant
much,
to it.
much faster. And,
exactly. So people that usually numb well with their dentists, I can gauge it by that. They numb very well with me. So.